Welcome to the Pulse with Peter B. I'm your host, Peter Biancamano. Let's get you to the pulse on everything you need to know. And we're here at Hoboken University Medical Center, located at 308 Willow Avenue in the beautiful city of Hoboken, New Jersey. And folks, I have been talking about him. He is like a superstar rock star for my family. He is my family's cardiologist, and now he's here on my show, and I am super excited to have him here. And that is the system-wide cardiologist here at the CarePoint Health, Dr. Bora Toklu. Dr. Toklu, great seeing you.
Thank you. Thank you, Peter, for the very complimentary introduction.
I was going to say that I kind of just throw enough adjectives in there for you.
Yeah, a lot of adjectives, but I appreciate it. Thank you.
Of course, Dr. Toklu. Thank you.
Take care of your beautiful family.
I appreciate that.
It's been a pleasure.
Thank you. And we appreciate everything you've done for our family. We really, really have. Talk to me a little bit about your background and what brought you to CarePoint.
So kind of like similar background in a way from that part of Mediterranean. I'm actually originally from Turkey, from the Mediterranean coast of Turkey.
Wow.
Born and raised there. And after medical school for residency, I moved to US. I was in New York City, Manhattan. I did most of my training at NYU Langone Medical Center in internal medicine and part of preventive cardiology training further over at NYU Langone. From there on, I moved to Mount Sinai system in New York City as well. So I did my general cardiology and finally the Montefiore system in the Bronx. So most of my training was in New York City, and the Bronx and Montefiore was interventional cardiology. After that, I moved to actually where in New York City is also, besides my advanced training, was where I met my wife. And we moved to the suburbs to Central Jersey.
Wow.
And about a year and a half ago, I joined the crew of CarePoint Health.
That is fantastic. And Dr. Toklu, heart disease is still obviously I think it's the second leading cause of death in the United States by cancer, if I'm not mistaken. What could people do at my age, the very, very young age, to prevent heart disease as I get older or as they get older?
I mean, that's a very important point because even though a lot of people think that cardiovascular disease is a condition of elderly, the roots of it actually starts at your age when we're younger. It's really boils down to the lifestyle, how we're really treating our body. Are we exercising? Are we not? What kind of habits we got? Smoking being a major risk factor for that. And those conditions that as we get older that we're diagnosed with, that we may not pay as much attention to, such as hypertension, high cholesterol, diabetes. Oftentimes I tell my patients, like I got patients, young patients like yourself come to me. They don't feel their blood pressure. They don't feel their cholesterol levels being high.
Right.
They don't feel their sugar levels being high. But I tell them, look, the more that you live with these high numbers, eventually, by the time the damage is done, it's oftentimes irreversible. So it's very important to have a good, healthy lifestyle, exercise, and a good diet as part of it, not just for cardiovascular health, for cancer, as you mentioned, as we eat healthier and we exercise better, we have a better mental and physical health, we know that we do reduce not just cardiovascular disease, but other causes of death as well.
Very interesting. And Dr. Toklu, finally, what do you think separates the CarePoint Health Services? Of course, that consists of Hoboken University Medical Center, Christ Hospital in Jersey City, and Bayonne Medical Center, differentiates the CarePoint Health Services to other acute healthcare facilities in the area?
Well, first and foremost, this is our home base. I mean, the Hudson County is where CarePoint is. A lot of the other facilities, those are usually big institutions, big hospital systems. They have a foothold or a satellite in Hudson County. But for us, this is our home.
Right.
This is my home. This is where my family, friends, relatives live. And that's how we treat our patients because, just like your family is my family in a way. So it's the compassionate care. I'm a little nostalgic when it comes to this, but as the medicine has kind of got modernized and got so fancy with equipments and treatments. Certain things I feel like we started to kind of miss out on. And that is that, you know, back in the old, you know, centuries where they had those house doctors,
Right.
that was that, you know, compassionate personal care. You know, that doctor would know those families, would know those patients. So I truly believe in that, providing that care, that personal care, that compassionate care. And truly, when I say it, I truly mean it. When I say your family is my family,
Oh.
you know, your grandma is my grandma.
My nonna, right?
Your nana is my
Absolutely.
nana.
Well,
So
Dr. Bora
I
Toklu, thank you
truly,
so much. Sorry.
absolutely,
Yeah, for your time. You know, thank you again for all your help with my family over the years. And
absolutely,
so glad
absolutely.
that you
My
could finally
pleasure.
be on the show. We're actually going to bring on one of your colleagues now, so you might want to stay tuned for that.
Absolutely.
All right, folks. More from Hoboken University Medical Center after this break. All right, still here at Hoboken University Medical Center, located at 308 Willow Avenue in the beautiful city of Hoboken, New Jersey, part of the CarePoint Health System, which also includes Christ Hospital up in Jersey City and our friends over in Bayonne Medical Center, of course, in Bayonne. And it's cardiologist segment time here on the Pulse this month here at the hospital. And joining us is Dr. Mohamad Soud, who is a system-wide cardiologist here. Dr. Soud, great to see you. How are you?
Happy to be here. Very good. How are you?
I'm doing great. As you can see, we had your colleague, Dr. Toklu, on just a few seconds ago. He thinks that he was going to outshine you, but I think you're going to beat me.
I think you crushed it.
All right, good. All right. So you agree?
We'll see.
Exactly. All right, Dr. Soud, why don't you tell me a little bit about your background and what brought you to CarePoint?
Right. So I lived in Syria my whole life. I finished my medical school there and then came to the US, kind of similar to what Dr. Toklu had. Did my medical residency in Washington, D.C., in Georgetown, and then my cardiology fellowship in New Jersey, Rutgers, New Jersey, and then finally my interventional cardiology fellowship at NYU Langone.
Wow, that is terrific, man. Why wouldn't you want him to service you, right? Dr. Soud, I was wondering, you know, Dr. Toklu and I spoke about what younger people can see or can do to prevent heart disease when they get older. But once a person does get older, what are some of the symptoms that they should look for in order for them, God forbid, right before they have a heart attack or something?
Right. So just like Dr. Toklu said, being, you know, eating healthy, exercising, and doing all this good stuff. And when people, let's say, exercise, walk, should watch for those two main symptoms we got usually: chest pain, shortness of breath. Those are kind of the main symptoms that might tell us some problems going on with the heart. So keep an eye on this, be healthy, eat healthy, walk, exercise, and try to watch for any of these symptoms. Having chest pain, having shortness of breath, you notice some swelling in the legs, something like this.
Some swelling in the legs. And sometimes it could be more than just chest pain. It could certainly be in the arms, correct? Or the shoulders or something?
Correct, yeah. So usually like the typical chest pain that would tell us maybe, oh, something is going on with the heart would be a chest pain, crushing, moving to the arm, left arm, neck. That might tell us, oh, maybe there's something wrong with the heart.
And then obviously if they feel any of those symptoms, you should rush to the hospital immediately. Exactly. And Dr. Soud, what do you think compares the CarePoint health system to other acute healthcare facilities in the area? What differentiates, I should say, CarePoint from the rest?
Yeah, just like Dr. Toklu said, it's the sense of community here. We take care of patients all over the Hudson County, from Jersey City to Hoboken to Bayonne. We're like a sense of family and community here. And just like Dr. Toklu said, we take it very seriously. We think of all the patient like family member here. And patient can feel it, and we get that feedback all the time.
Yeah, no, that's terrific.
Yeah,
and I'm sure you see that all the time where there's a patient who comes back and they're
correct,
like,
yeah.
well, you know, where's Dr. Soud?
Right, exactly.
Absolutely. Well, Dr. Mohamad Soud, thank you for joining us. The system-wide cardiologist here at the CarePoint Health Systems. And you're all over, right? You're in Bayonne,
Exactly, yeah.
Hoboken,
all over 3 hospitals.
all over 3, and of course the little doctor office. This is correct.
Exactly.
Yes. So you can definitely look him up on the CarePoint website and find him. You know, he's kind of all over the place, but I'm sure you will be able to locate him.
Thank you for having me.
Absolutely. Thanks again. All right, folks, from Hoboken University Medical Center, located at 308 Willow Avenue in Hoboken, we will be right back. Peter Biancamano, your hostess with the mostest of the Pulse with Peter B. Folks, don't forget to go on our Facebook and our Instagram pages by searching The Pulse with Peter B, and like and follow us on each of those platforms. We're constantly updating those pages with previews of each week's segments and cool stories. Also, if you have any questions, feel free to reach out to our email address at thepulsewithpeterb@gmail.com.
Welcome back. I'm your host with the most, Josh Sotomayor Einstein, and I'm so glad that I am not joined by that bum Biancamano. I know in the previous segment, everybody saw him with these wonderful doctors, and it was a contrast between knowledge and ignorance, Peter being the ignorant and the doctors having the knowledge. But this segment, we're joined by someone that is and has a background in business and in the community. We are joined by President of the Hoboken Business Alliance, James Runkle. Thanks so much for joining us.
Thanks for having me. Appreciate it.
It's an honor. So for the people out there in TV land and on the interwebs, why don't you tell us about yourself first and then about the Business Alliance?
Absolutely. I'm James Runkle. I've been a resident of Hoboken for 20 years. I've owned a business here for about 10 years. So live here and love it here. And Hoboken has been so good to me, both professionally and personally, that I feel like when you get a lot from a community, it's important to give a lot to the community. Mm-hmm. And that's what got me involved with the Hoboken Business Alliance. We exist. Our entire mission is to enhance and evolve the business community here in Hoboken. And so we exist to help support businesses from everywhere throughout the town.
Oh, that's really cool.
Yeah.
Now, the Business Alliance helps like a particular type of business or all businesses, or what's its remit? What's its mandate?
The Hoboken Business Alliance is actually special. A lot of Business Alliance will focus on, let's just say, just the Path area or just the business on Washington Street. We're unique in that we are the entire mile square. So dry cleaners, antique shops, insurance brokers, restaurants, resellers, everyone in this community that pays into the business taxes are part of our community, part of our membership.
Oh, that's really, really cool.
Yeah.
Now, you said that you were a business owner yourself.
Yeah.
What's your business?
Yes. So I own a marketing company here in town, focusing on digital, social, advertising, websites, that sort of thing, and been fortunate to work with Hoboken Public Library and a lot of different local institutions. So it's been great just to get more and more involved in the community.
Oh, that's really, really cool.
Yeah.
So have you been involved in the Business Alliance since it started?
Yes. The Business Alliance was founded in January of 2020. 3 months later, the world shut down because of COVID. So the Business Alliance spent a year maybe saying like, hey, don't come to Hoboken, maybe, stay there, maybe, stay home through COVID. But now we have a new leadership team, we have a new staff, we have a new executive director. So we spent the past year really building back up. And now that the world's opened back up again, we're able to have events, have promotions, increase tours, and work on all the public realm, all the beautification. Placemaking is the word we really go with, to really make Hoboken business community even more special than it was before the pandemic.
Oh, that sounds really, really terrific.
Yeah.
What are some of the things that people have to look forward to with coming out of the Business Alliance?
Well, we are solidly in the holiday season. And so, number one, I want to encourage everyone to shop local, support your local businesses. Hoboken is rated, as I'm sure you know, the #1 most walkable town. We have every imaginable business that you can think of here. So when shopping for presents, when getting gift certificates, think local, shop local. So that's number one. Also, we have a lot of great holiday promotions coming out. I would encourage everyone to follow us on Instagram and Facebook. We are at Hoboken Alliance. And so, get involved, watch for that. We'll have a lot of special holiday promotions as well as holiday decorations. There's, of course, the tree lighting ceremony that comes up. That's just a citywide event people love. So much happening this holiday season. Definitely follow us on social to follow along.
Now, can we call it a Christmas tree this year? I'm not a Christmas person. I'm a Hanukkah person. But I hate when people call it a holiday tree. It's a Christmas tree.
We partner with the city of Hoboken on a lot of events, so we're not in charge of the titles, but absolutely we can call it whatever we like.
I know, I just asked you a question that you have no control over. It's the city that does, so it wasn't fair. But I hope you don't feel ambushed.
We want everyone to feel included, and so whatever you like to call it, we support it.
I feel that. Well, it is a Christmas tree, and I definitely am excited to come back after the commercial break and learn more about the Business Alliance. Out there in TV land, stay tuned. We'll be right back.
Welcome to Hudson River Care and Counseling. Hello, I'm Dr. Pam Pater-Ennis, the CEO and founder of Hudson River Care and Counseling with over 30 years of clinical social work experience in therapy. We are a progressive counseling and coaching practice with a diverse team that brings a holistic approach to clients. We offer support both in person and through digital platforms such as telehealth. Consider us a safe haven that you can trust with care for your mental health needs. Visit our website to set up a consultation today.
Welcome back. I'm your host with the most, Josh Sotomayor Einstein, and I'm glad you stayed with us, and I'm glad our guest, James Runkle, president of the Hoboken Business Alliance, I'm glad he also stayed with us. When we left off, we were talking about Christmas and Christmas trees and going into an equally hard topic. I'm going to ask you something. There are people out there in town that have questions about the Business Alliance. One of which that I've heard a lot is, what's the difference between the programs in terms of beautification or lights that the Business Alliance does and the old programs that the city used to do?
Sure. That's a great question because we are a relatively new organization and there's a lot of unknowns. So this is a great opportunity. Thank you so much for this. We are funded by businesses, taxpayer. That's where our budget comes from. We offer supplemental services to the city. For example, when you mention lights, that's a placemaking kind of beautification effort because while our core audience, we're funded by the business community, all ships rise. So residents, partnerships with local organizations like Homeless Shelter, the Hoboken Community Center, Historical Museum. These are all part of our ecosystem as well. So when we do things like supplemental cleaning services, for example, we've increased our clean team hours that are out there by 3 to 4 times. So when commuters walk to the path, residents walk to the path and get off the path at night and come home, and the streets have been power washed, and the trash has been picked up, and the rat abatement has been supplemented as well. People are more likely to stop in a restaurant for dinner, stop at a retail store and pick up a gift, stop and buy flowers, support local businesses. So all these things are supplemental, to the importance of our business ecosystem as well, and things that we are doing. And one thing I'd absolutely recommend, because we are new and we want to spread the word as much as possible, but when folks have questions or when there's any ideas or anything that might be out there, let us know. Comment on social media, DM us. I can give an email address if that's okay. Email us.
Absolutely. We'll put it on the screen.
Great. Yeah, email us at office@hobokenbusinessalliance.com. That goes directly to our staff members so we can sort through emails and send it to the right person to address the issue right away. Communication is so important, and everyone in Hoboken is part of the same effort and part of the same initiative, so we love hearing and creating those dialogues.
Well, I think everyone in town has definitely seen the clean teams, especially on the Avenue, on Washington Street, and really appreciate the rat mitigation efforts because, as everybody knows, unfortunately, we definitely have a vermin problem, and I'm not just talking about City Hall. But the reality is, or I think the reality is people want to know, obviously, like everybody goes into the small stores and the restaurants, but are there businesses in town that the Business Alliance is helping that aren't necessarily, the mom and pop shop or the store, like the service type of business that maybe we know has an office in town and employs people in town, but we don't even think about because we don't see them as a storefront?
Of course, absolutely. And there are commercial real estate holders. There are office building holders. These are the W Hotel. These are big parts of the budget that pays into our budget, that tax base. So these are all stakeholders as well. And everything we do, but also there are folks in parts of Hoboken that maybe aren't Washington Street, that aren't path. And so things like the beautification, the planters that you see on the corners, because as someone walks down the street and sees a beautiful planter on a nice clean street, that means that someone cares. And when someone cares about that block, people want to live on that block. And when people want to live on that block, they support businesses in the area. So it all helps each other one and throughout. And also, to your point about different businesses, there are, if we can just talk rat mitigation, which isn't the best topic necessarily, but it's a very important one. And so things like sending out our street cleaning team and exterminators for the parklets to crack them open and get underneath there. Those displays we mentioned for that folks probably saw the fall display on 11th Street or the holiday displays. we take extra care that we are not just creating somewhere that rats can live, but part of everything we do thinks through from A to Z. Not only is it beautiful and helps businesses and residents, but also there are rat mitigation efforts going on as well, woven throughout everything we do.
That's very, very terrific, and I'm so glad that you're able to join us. I hope you'll come again in the
Such
future.
a pleasure. Thank you so
All right.
much.
Thanks so much for joining us.
Absolutely.
Stay tuned. We'll be right back.
Peter Biancamano back with you. Don't forget to watch us on cable access every Sunday and Monday at 9 a.m. Optimum Channel 18, Files Channel 46, and Comcast Channel 190. Also on Sunday mornings at 9:30 a.m., you can watch our show on our YouTube channel, and you can also binge watch all of our old shows. Who doesn't want to keep watching The Pulse with Peter B? We'll see you there.
Welcome back. I'm your host with the most, Josh Sotomayor Einstein, and I'm so glad to be joined not by that bum Biancamano, but by my friend Paul Presinzano. How you doing?
Good to see you, Josh.
I'm
Thanks
glad,
for having me.
Glad to have you here again. For viewers out there that don't know, there will be a runoff in the first ward in Hoboken, and Paul will be one of the contenders. So we're having you back here. How's it feel to make it to the runoff?
It's actually awesome. It's great to feel that the community basically picked a winner. Unfortunately, well, I wouldn't say unfortunately, I think it's a positive thing that some of the laws that were passed or headed by Councilman DeFusco actually did its job here, that 50% of the people need to decide in one vote. So hence we head to a runoff, which, is a little tough on the family, but, it's democracy in action, and, I'm happy to be a part of it.
Well, that's really, really terrific. Now, I know you already went through one campaign, and I'm sure you've said it 5 billion times, because everybody knows out there that you knock on doors like a fiend, like it's going out of fashion, like it's your habit that you're addicted to. Can't think of any other synonyms that means that you knock on a lot of doors. But what have you seen now that you're heading into the runoff election are the top 2 issues for you?
I think the top 2 issues still center around the rats, which kind of still filter into the quality of life. One key thing that we have here is the e-delivery system, or e-delivery bikes that are on our sidewalks, is a massive thing at the doors that people are talking about. So from that perspective, those would happen to be the ones that still sit there. It is nice, though, when you do go to the doors, the people are actually aware that there is a runoff race. And so that's a very good positive thing, I think, for the community, that there is the word, there is the buzz, but we do need people to understand that in these elections, there tends to be a lower turnout. So that is something that I'm hoping that all the news outlets and the city and everybody else spreads the word that basically December 5th, there is a runoff election for the first ward, and we want everybody to turn out and have your voice heard.
And we'll put something on the bottom, just saying when the date is, and just reminding people all throughout this segment, so that people out there on the interwebs and in TV land remember to vote. Vote early and often. Just kidding. It's an old Hoboken, Hudson County saying that is technically illegal. Just vote once, all right? So it's interesting you brought up the e-bikes, because I remember at the debate, that was an issue that came up of the e-bikes and delivery people in general, just swamping areas of town or sides of the street. And so what would you do to try to ameliorate that problem?
I think one thing we have to look at, Josh, is that the first ward is the commercial district. So hence a lot of the starting points of delivery happens from our area. There's pros and cons of it. We see a concentrated effort of e-bikes, e-delivery. Let me make that clear. There's cyclists and there's e-delivery. I'm happy to see people make a wage, and I want people to work. It's better for the environment, but we have laws and we have rules in this town. They need to be enforced. I want to give the public safety enough resources that they need, whether it's training, whether it's e-bikes, to help them in their job. But ultimately, I think, as I said in the debate, to sling drinks in this town, you need a license or you need some type of identification. I would like to see a program where we have that. There is an issue that with some of our delivery personnel that at night you cannot see them. When they come down the road, some of their bikes are not equipped with the correct lights and that nature. I would like to see a reflective vest on them. And with that reflective vest, we can have an identification on there, a number that, so in case something does happen to them from a safety perspective, we can immediately know who to contact from that perspective. But again, it's about providing safety, safety for the people walking on the streets, walking on sidewalks. I think the sidewalks is the biggest issue, and our families need to be safe, our seniors need to be safe, and you shouldn't have to learn to play Frogger when you're trying to get from point A to point B.
Well, listen, I have a fair amount of friends with kids, and I have a lot of friends that are getting older in the years, so to speak. And even for myself, when there's a whole bunch of bicyclists, you know, delivery people or whatnot coming which way on the sidewalk, it's hard to know sometimes which way to jump out of the way, especially at nighttime if there's a lot of people on the sidewalk on Washington Street on the avenue. So it's definitely a challenge. When it comes to public safety, I know that also at the debate, it was an issue that was raised of people smoking marijuana in our parks. So what would you say about that?
The law is complicated because it doesn't really state what officers can do. We have passed things locally that there's no smoking in parks. In today's society where people are a little sheepish to actually approach someone and say, hey, you know, my children are around here, would you be so kind? I've learned from people that partake in cannabis that you can approach them, and they tend to understand if you just say, hey, listen, I've got my kids over here, can, you know, and most of the time they'll move on. It's a little difficult because it happens so quickly, is that, you know, by the time you make a phone call or by the time you reach someone, it's already over and whatever from that perspective. I would like to see a little bit more of, if we have a little bit, maybe a more police presence, as we did in Church Square Park when we had an issue with some of the homeless situation or the unhoused. I think that maybe we have a little bit more of a presence. It might actually send a message that, you know, hey, listen, this park is for the kids, for the community to enjoy. Let's everybody respect each other. And, you know, there are things that you can enjoy the park just as much as I can. Maybe just relocate to a separate part of the park.
I hear what you're saying. Now, other issues that maybe I've missed, what do you think's going on in town?
Well, I think, you know, overall, Hoboken's an awesome place to live. I mean, you're not going to complain. I see you in the street when we walk down with my son and my wife. I believe that there's always a chance to do better. The status quo just doesn't, it's not in my vocabulary. We can do something great tomorrow. We can do even better the day after. So for me, I think that the quality of life issues since we've come out of the COVID pandemic, that those have kind of deteriorated to some. And this goes back to safety on the streets, safety on the sidewalks, our four-legged friends running across, you know, at night. You know, we're heading into the winter months, and that's a concern for me, that they're going to get closer to our homes. You know, I don't like seeing rat feces on the ground, and it's a health issue for children. Just as, you know, we have geese issues in the parks for our animals that are there and stepping on it too. So I think it comes down to is clean streets. You know, I think Washington Street is the gem of our town, and it's the gateway to our town, and we need to make that look pristine. I believe that it's fallen a little bit under what I would call an average street. I think there's a lot of grease stains. You know, the tree pits are a little bit bad. Garbage sits on the sidewalk at night. Maybe we need to look at something where we actually have two-time pickups. I mean, not that I'm going to compare America to France, but in Paris, they pick up garbage 3 times a day. And there's a reason for that. And so if we do have a vermin issue, I think that's something maybe or potentially we could explore.
I hear you, and I will forgive you for comparing us to the country we had to rescue from the Germans twice. So not everything about France is bad.
It's an example, is just to say how they've mitigated a problem over there.
They made croissants, and apparently now they have more, you know, trash pickup. So 2 good things about France. So anyway, I really, really appreciate you coming on the show. I hope you'll come back again.
Yes, if you'll have me.
Oh, absolutely.
And I think we have a debate coming up. Is that
correct?
correct?
Yeah, and we're definitely going to have a debate, and we'll put up the info on screen. But we got to get out of here. So I hope everyone at home had a wonderful episode. Tune in next week to The Pulse on everything you need to know.